So dear friends, in the previous class, we were discussing about the Sancha Yi, Sancha and Sancha Sun. And these 3 points are very much effective. We have tried already, and all of you have also posted. We can put the normal needle and we can put the sujog needle, any needle, right? Sancha E working for the upper body, Sancha working for the middle body, Sancha Sun working for the lower body. Or we can tell Sancha E working for the upper spine, Sancha working for the middle spine, and Sancha Sun is working for the lower spine. But all together, they are working for entire spine. So suppose if we are using all the 3 points together, is a wonderful combination for all spinal problem, right? So we were discussing about the Sancha Yi. Sancha is very good for the neck pain, shoulder pain, and regulating the chi of the upper part. So regulating the chi of lung. So when you are putting the needle here, we can put the needle from the margin, then we will carry the needle and we can even put the 2 chun needle, or we can put the 1 chun needle, or we can put the sujog needle. And we can bring the lung chi in the harmony. It's a wonderful point for the lung chi. It's a very good point for the upper part of the body, so very good for the shoulder pain. Then after that, not only it's working for the upper body, when we are regulating the lung chi, we already know lung is having connection with the urinary bladder as per the organ clock cycle. The timing of lung is 3 to 5 in the morning. The timing of urinary bladder 3 to 5 in the evening. Both are connected with each other as per the organ clock opposite timings. So when we are regulating the lung chi, it's also working for the urinary bladder. That's why it's also regulating the lower back pain. So even this is very good for the upper part, but also working for the lower back pain. That's why we are putting all the 3 points for the lower back pain. So it's very good for the stomach pain. Even it's very good for the female menstrual problems. When the lung chi is good, then female will be, male and female both are having good energy in the body. Ultimately, we can treat all the problems happening in the spine anywhere. Then we're talking about the center point. We know this is the finger of pericardium, or the finger of which is working on the pericardium. So it is also very good for the heart. The middle finger is the finger of pericardium. So that's why it's also very good for the heart. And the point next, A0T, A03 or Sancha R. Sancha R is the point between the middle finger and ring finger here. We are putting the point in the bay margin. So this is a very good point for heart because it's just next to the middle finger. Actually, middle finger is good for heart. Even the ring finger is good for heart. So this point located in between, that's why this point is very one of the great point for the heart. So this point is strengthening the heart. Why the person offering ring in the ring finger during the marriage? Because ring finger is having connection with the kidney, connection with the genital, even connection with the heart. And middle finger is also having connection with the heart. And the point we are putting in between, it's a wonderful point for the strengthening the heart. And as per the master room, any point strengthening the heart will be strengthening the knee. So we are putting the needle in the center, and we can take the needle till the full length till here. We can put the 2 chun needle or 1 chun needle or a half chun needle, even the sujog needle. We can start with any needle. So in this way, this is a very good point for the heart as well as for the knee pain. Definitely all the points are very good for the lower back pain, lumbar pain, sciatica pain. Now, here I would like to bring a focus. Sancha and the Sancha Sun is very good for the sense organ. What is the sense organ? The meaning of sense organ: we are smelling from the nose, we are looking from the eyes, we are hearing from the ear. So ear are the sense organ, nose is the sense organ, eyes are the sense organ, skin is the sense organ, tongue is the sense organ. So there are 5 sense organ. All the sense organ are getting the improvement if we put this point. Then the next point, Sancha Sun here. The Sancha Sun point is also very good for the sense organ. So if we want to improve the senses, we want to improve the vision, we want to improve the hearing, we want to improve the taste, we can put both the points. Both points are very good for the senses. Now again, because this point in between the ring finger and the small finger, and we know the ring finger is having connection with the heart indirectly, and a small finger is also, we know there is a heart meridian is going in the from the small finger. So when we are putting the point here, A04, it's a very good for reducing the chest pressure and the chest and the rib pain. And definitely all the points are very good for sciatica pain, low back pain, neck pain. We know the triple worm meridian is passing from here. If we see the root of the triple worm meridian, it's passing from here, from this area where we are putting the last point, that is Sancha Sun here. Triple wormer 1, triple wormer 2, triple wormer 3, this is passing from here. So when we are putting the needle here, starting from the triple wormer to a needle going in the full length, and we are covering this area, it's treating the triple wormer. So it's treating the neck pain very nicely. This is a very good point for the ear pain, for the neck pain, for the eye problem. So it's a wonderful for all the senses and the neck pain, right? So we already discussed these all things in the last class. Now, I would like to bring a focus on this last point here, A04. A04, one of the great point. Out of all the 3, we can give number 1 marking to this point, A04, or the Sancha Sun. It is one of the great points. I will tell you that the too many indications goes to the A04, right? We are putting the needle here and inserting the needle in the full length. If we see the reflexology, in the reflexology, we are drawing the ear here, ear. We are drawing the ear here, ear, in the reflexology. And in the, as per the Dr. 10, this is the great point for the eyes. So again, I would like to bring a focus. This is one of the great points for eyes, for ear, for all the sense organ. Right? Suppose someone is having some heaviness in the eye. You put this point. Within 5 seconds, heaviness from the eyes will disappear. Within the 5 seconds. You can try it. This is one of the great points for the eye pain and even the flutters. Flutters means we already know what is flutters. When some points are flying, when we are looking right and left, up and down, anywhere, but constantly something is flying in front of eyes because there is a wrong with the vitreous humor in the eyes. We discussed in the previous class. So when you want to treat the eye, you have to take the kidney 7 point. Kidney 7 is a very good point for the eyes. We have to take the Shangguan. Shangguan point is very good for eyes. It is also called kidney gate. Again, we are taking the kidney point. And we have to take Dawai. Okay, so 1, 2, 3, 4 point we have to take. I already discussed in the previous class about this, right? So you can go and see all the point detail. I have demonstrated the location of kidney 7. Even I've demonstrated the location of Shangguan, which is one below from the spleen 9. Even we already know the Dawai. So this 4 point combination is very good for flutters. Then regarding the sore throat in the previous time, initially when we were discussing about the master tongue palm diagnosis, if you remember, am I audible clearly? Initially, I told you this is the area from here to here, represented in the earth element, spleen area. So if we want to remove any dirtiness from the body, we want to remove the unwanted deposition of the joints, like in the rheumatoid arthritis, there are dirtiness, there is a deposition, there is a ama, there is a toxin are gathering in the joints. We have to treat this area. This is the area of earth element. It's thumb area and the area below the thumb, this area. This whole area is having connection with the earth element. Earth element, dampness, dirtiness, turbidity, kachra. If we want to expel kachra, then you have to work on the earth element. So this area is having connection with the earth element. As per the master tongue, we are adding too many points in the thumb to remove the unwanted swelling, dirtiness, the toxin of the rheumatoid arthritis, toxin of the gout, the leukorrhea, white discharge, any unwanted pus formation. If we want to expel, then we are working here, right? Even if we see some blue vein here, then this is the sign of earth element. Earth element means stomach, spleen. So it means, oh, the blue veins means the person is having too much stomach heat, because blue veins are here. This area, entire area is connected with the earth element as per the master tongue palm diagnosis. So blue vein here, oh, the person is having bad stomach, dirty stomach heat. Okay. Now, as per the meridian concept, we know in the yin yang junction here, this is the location of lung 10, right? So lung 10 is one of the great points for throat. In the TCM, it has been explained the lung 10 and the lung 11, both points are one of the great points for throat. Now, one more thing I would like to tell you. This area is removing the unwanted dirtiness. As per the Dr. Bohl, the lymph meridian is passing from here. Again, what is lymph meridian? Lymph meridian is the meridian who removing the lymph. What is lymph? The meaning of lymph, removing the dirtiness by lymphatic drainage. So this area, one of the great area. If someone is having too much dirtiness in the body, should massage this yin yang junction from here till here every day. If you massage this yin yang junction starting from the corner of the nail till the here, it will remove dirtiness from entire body, because as per the Dr. Bol, this is the lymph meridian. As per the master of this is the spleen area or connected with the dirtiness. Okay. So we can massage this area. We can massage this area. Now, in between here, this is the location of lung 10, and if we needle the lung 10, right? If we needle the lung 10, it's a wonderful point for the sore throat. So what we can do, one point we can put here, Sancha sun. Sancha sun is very good for all the senses. It's very good for the nose, sinuses, cough, throat, pain. So Sancha sun and the lung 10, one of the great point combination for sore throat. If you want, you can also add lung 11. So let's see here. So if someone is suffering with a sore throat, Sancha sun and the lung 10 combination is one of the great combination. We can use these 2 points, because if you want to work on the sore throat, lung 10 is a very good point. Even the lung 11 is a very good point. But if we are adding the lung A04, it becomes a wonderful protocol. Let's see here. So these 2 points, number 1, lung 10 is very good for the sore throat, and number 2, lung 11. Lung 11 all found in the tip of the thumb, that is lung 11, right? Can you tell me the third number point? There are 3 very good points for the sore throat. Anyone knows? As per the DCM, which is the third point, very good for the sore throat. I'm giving you 5 seconds. Otherwise, I will tell. Very, very important point. Okay, CV22 is good for asthma. Stomach 9 is the local point we can stimulate. I will tell you as per the TCM, stomach 9 we can't needle. I'm asking tell me the point we can needle for the sore throat. Very good point, wonderful point. One of the great points. There are too many points, yes. Maybe you're right, because you are telling lung LI11. I can't tell these are the wrong point. Even these points are right. But I will tell you, even stomach 44 is right. Okay, let me tell. Stomach 43. Stomach 43 is one of the great points for sore throat, right? But I can't tell that you have told wrong. You're writing stomach 44. Okay, it's good. Lung 4, it's good. Stomach 9 is good, but stomach 43, one of the great points for sore throat. 43. And stomach 43, if the person is suffering with the sore throat, you can try the stomach 43. Because sore throat, many times sore throat is because of the disharmony of the stomach meridian. So this is the stomach 43. So stomach 43 is the very good point for sore throat. Now you are treating the stomach 43, it will work on entire stomach meridian passing from the throat. So it will remove the disharmony of the throat. This is the stomach 9. We can massage the stomach 9. It is also the very good point for the sore throat. CB22 is also very good for cough and asthma. There is no doubt. These all points are working. But stomach 43, one of the great point, and lung 11 and lung 10, right? So we can combine with the A04 as per the master tool. A04, even single point is very effective. When you are putting 3 needles here, 1 needle here, 1 needle here, and 1 needle here, all the 3 needles together will do one very wonderful thing in the body. All 3 needles together will strengthen your spleen greatly. I will tell greatly. All the 3 needles. all the three needle will strengthen your spleen in a very, very wonderful way. What will happen if you are strengthening the spleen? If you are strengthening the spleen, what will happen? You know, what is the work of spleen? Number one, spleen is responsible for keeping spine in the alignment. So spine, bone, 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 bone. There are too many bones in the spine, but between two bones, there is a disc, right? There is a disc, right? So suppose these are the one bone. This is the bone number one, and this is the bone number two. But in between, there is a disc. There is a disc. So there are too many bones, but everywhere disc is there. So the bone will, if disc is not there, then what will happen? There is a friction of the bone. Then they will damage each other. They will damage each other. The friction of the. So what spleen is doing? Spleen is giving power to the disc, not the bone. I'm not telling it's giving the power. Suppose this is the bone and this is the bone. Spleen is giving power to the disc in between the bone. Disc. Disc is like a very soft paneer, like a paneer. Very, very soft, having liquid inside, having fluid inside. If disc is good, then spine, the bone will be on its, their bone will be having perfect alignment. But if disc is drying, then bone will come near to each other. So what I want to tell you, if you strengthen the spleen, you are strengthening the disc, then slowly and slowly you will see your spine will become wonderful. Because what people are doing, getting the problem, there is a drying of the spine, there is a reduction of the gap because disc is not getting enough nourishment. We are sitting all the time, so there is a compression of the disc. Bone is hard. Bone is giving the compression here and there. So if we are strengthening the spleen, Sancha or Sancha Sun will strengthen your entire spine while strengthening the disc. Okay. So if we talk about the spur is a different condition. Why? I will tell you. Spur is having connection with the bone, not with the disc. So look at here. We can see they are the bones, vertebrae. The target of spleen is not the vertebrae. The target of spleen, the space in between the vertebrae here. This is the place where the disc is located. Disc. So the target of spleen is this. So when you are putting Sancha E, Sancha and Sancha Sun, it's strengthening this space. So now I will tell you one of the great thing. Suppose if you are putting these points to the kids, you can strengthen the height. It's difficult because kids will not allow. How they will allow to put the longer needle in between the knuckles? Not, but you can do massage. If you do the massage here by using the little oil or the fingers, I am doing the massage in this part. I am strengthening the area between the two discs. So disc will be nourished, then it will keep all the bones in the alignment. So we can enhance the height, right? Because Sancha is very wonderful for spleen, then Sancha E is good for lungs, Sancha are good for heart, Sancha Sun is good for kidney. Ultimately, altogether they are working in the entire body, right? Now, if the person is suffering with the insomnia, will get the wonderful results. Why these 3 points? Even if you do the massage, even doing the simple massage here will bring the very deeper level of the sleep. If you massage all the three areas, it will bring very wonderful and the deeper level sleep. So in this way, we can see, I'm telling you once again here, from the spleen 9, if we go 1.5 tune down, that is the location of kidney gate. It is very good for kidney. It's very good for bone. It's very good for fertility. It's very good for eyes. And even from the, we know the location of kidney 7. It's also very good for eyes. So these are the demonstration of, these are the images of 2 points. We were discussing the good point for the eyes. The good point for the eyes, 77.18, and this kidney 7. So this is the 77.18, which is 1.5 turn below from the spleen 9, and 77.28 or kidney 7. One of the great point for eyes. So we can combine with the A04 or Sancha sun. Now look at here. If we talk about the urticaria, what is urticaria? Urticaria is the condition when suddenly there is a red eruptions, red patches happening over the skin. That is called urticaria. It's allergic reactions. It's allergic condition. Okay. So what is urticaria? Urticaria can be considered a attack of wind. This is the attack of wind. That's why person is getting immediate reactions all around. But with the wind, there is also heat. That's why eruptions are red in color. Okay. If you want to arrest the urticaria, then immediately you have to expel wind. This is the first target. Immediately expel wind first. So how to expel the wind first? So the number one treatment, ear apex bleeding. So if someone is having urticaria or sudden allergic reactions or hives, we are telling hives, then the first treatment, which will be giving excellent result, immediate result within few minutes, do the ear apex bleeding. So the question comes, where to bleed? Top? So the answer is you can bleed anywhere from this area, anywhere. You can bleed from anywhere. This is a upper circle, and it will give wonderful results in the urticaria. Point number 2, I will tell you, we already know gallbladder 31. I already told you multiple times, but I will tell you once again. So if I'm doing like this, so where my middle finger is touching my thigh, this is the point. That is called gallbladder 31. As per the master tomb, the name is different, 88.21, 88.25. As per the master tomb, 88.25, we will be discussing during the discussion of thigh. But right now, what I want to tell you, as per the master tomb, this point is 7 chun up from the knee. From the knee, if I measure 3 chun, 3 chun, and 1 chun, 7 chun up. Or if I'm standing erect, where the middle finger is touching, this is the location of gallbladder 31. Gallbladder 31, one of the great point to expel the wind. I will tell you, any types of the pain happening anywhere in the body, we can expel just by gallbladder 31. Gallbladder 31 is good for headache, good for migraine, good for eye pain, good for neck pain, good for shoulder pain, good for hand pain, good for upper back pain, middle back pain, lower back pain. knee pain, any pain which is happening anywhere in the body. In the Ayurveda, we are telling, oh, Vata, Vayu. In the acupuncture, we are telling Bind. We can expel any pain just by gallbladder 31. The list of the gallbladder 31 is very big, like it's a wonderful part. So we have to put one needle on the gallbladder 31, it will expel entire Bind. Okay. In the TCM, what we are discussing, the TCM, we are telling, okay, hairline. Hairline is a very good area. We can massage the hairline, or we can put multiple points on the hairline, like 1 point here, 1 point on the back side, on the depression, 1 point on the side in the depression. So around the hairline, if we put the point, they are the very good point, and they will expel the Bind. Another point, gallbladder 31. So gallbladder 31 is the very good point that is called antivirus point, antibacterial point, anti-fungus point, means anti-pathogenic point, because what is wind? As per the acupuncture, the meaning of wind is virus, bacteria, pathogen, or even the cold air, even the hot air, even the just only the air, even the air having coldness and the dampness. So this is the meaning of wind. So any type of wind we can expel by the gallbladder 31. Gallbladder 31, one of the great point who is working against the virus and bacteria. Because I'm telling it's a very good point for the wind. Just do not think, oh, wind means air. Don't think that much. The wind means virus, bacteria, COVID-19, all the virus of the flu, the virus, bacteria of tuberculosis, all the virus, bacteria, pathogen coming under the wind, and gallbladder 31 is one of the great points for that. So the list of the gallbladder 31 is very big. Okay. So in this way, suppose someone is having urticaria, that is also wind, urticaria. So bleed ear packs, then put the point gallbladder 31, even this is enough. You will achieve the result. But you want to go ahead little? Then Sancha. Now effectiveness will increase multiple times. Sancha. The Sancha, one of the great point who will calm down the entire kidney yarn, entire heat. So will expel the urticaria. So look at here the list. Look at here the list now. The very great protocol for the urticaria. We are putting the needle toward the heart 8. This is the condition. Okay. So we are putting the needle in the Sancha and directing the needle toward the heart 8. So we are putting the needle from on the Sancha. And heart 8 is here. We know heart 8 is here. So we are directing the needle toward the heart 8, from here to the heart 8. Little direction. Heart 8 is the very good point, which is just we'll be discussing after a few points, because heart 8 is also coming in the palm. Heart 8 also explained by the Master Tung, and Master Tung has given a different name. As per the Master Tung, heart 8 is the medical emergency point. We are using heart 8 in the emergency condition, so we'll discussing. Right now, I want to tell you for the urticaria, your first point will be Sancha, putting the needle toward the heart 8, second ear apex bleeding, third gallbladder 31, and the fourth and the last point. Because urticaria is ultimately the problem of the skin, and people are suffering with the urticaria on and off. You have to do the treatment on the one point that is called leg rapid horses. 88.17, 88.18 and 88.19. Initially, I have discussed this point with all of you. These 3 points available in the thigh. All the 3 points available in the thigh, and as per our previous discussion, I told you this is the stomach meridian. These all the 3 points available in the thigh in the root of the stomach meridian. So from the knee, if I go 5 tune up, then the 2 tune up, then the 2 tune up, there is a 3-point combination called leg rapid horses, or 88.17, 1819. These are the one of the great points for skin. I will remind you why these points good for skin, because as per the imagination concept, if it is the imagination of the whole body in the leg, so this is the head region, or the buttock area is the head region, this is the chest, this is the navel, this is the abdomen, and this is the genital part. So regarding the chest area, this is the chest area. So when you are putting the needle here, 88.17, 18 and 19, they are working on the chest, they are working on the lungs. Why they are working on the lungs? Because we are putting the needle in the stomach meridian. So these needle working on the lungs because stomach meridian passing from the lungs. We can see how the stomach meridian passing from the lungs. So that's why we are treating the lungs, and we know lungs is treating the skin. So 88.1718 are the 3 points we are combining. So this is the permanent relief. After a few sittings, person will be getting permanent relief from the urticaria. Otherwise, what's happening? Urticaria is one of allergic problem. A person is getting the urticaria and you are treating the person, but urticaria will be coming back again and again, right? But if you're treating with this protocol, number 1, A04, leg rapid horses, ear apex bleeding, and gallbladder 31 or the 88.25. There's a permanent relief of the urticaria because we are treating the lungs from, and there is a disharmony of the lung which is appearing in the form of urticaria. So we are treating the ear apex, we are expelling the inflammation, we are treating the lungs, we are treating the problem from the roots. So this is one of the great point for urticaria. I think it's clear. All of you clear this? Urticaria. Urticaria is also called hives. So look at these person. Look at these urticaria looking like this. You can see in this image. Sometimes these spots are very, very red, suddenly appearing in the body. Look at it. Suddenly appearing in the body with red eruption throughout the body. Sometimes it's happening because of the medicinal allergies. Some person is taking some medicine and suddenly getting the allergies. Immediately we need to do ear apex bleeding immediately. Sometimes these allergies are so dangerous, so dangerous. Even person might lose the life. Okay, that's why before giving many medicine like the penicillin, they used to do the investigation by putting the only one drop of penicillin first and seeing whether body is having some reaction or not. Suppose if you put full penicillin injection and person will be getting severe urticaria, severe allergic reaction, anaphylactic reaction, and will lose the life, then it's difficult to treat. But nowadays it's very less. But previously many persons died because of the reaction of penicillin, right? Nowadays, it's very rare because everyone is alert. Okay. 88.17. No, it's not the center of the thigh. 88.17 is the point found in the stomach meridian. Center of the thigh is heart. If you remember, if you look at the thigh, this is the thigh. This is the thigh. The center of the thigh means that is the connect with the heart. We are going in the stomach meridian. We are going in the stomach meridian. In the stomach meridian, we have to put 3 point, 5 tune up, then 2 tune up, then 2 tune up. So how to search the stomach meridian? We can feel the bone here. We can feel one bony part here. ASIS. Now from this bony part till the lateral angle of the knee, if I draw one line, that is the stomach meridian. So from the ASIS till the lateral angle of the knee, I will make one line, that is stomach meridian. I have to put all the 3 points in this line. Even I can put the point randomly. Suppose if I'm not putting the point 5 tune up, 2 tune up, 2 tune up, there is no problem. But we should choose the perfect line. So how to choose the line? We can feel the bone ASIS till the lateral line, lateral corner of the knee, that is stomach meridian. So the leg rapid horse is found in the stomach. Is it clear? Even this line is clear to everyone. Hand point one side and the leg point other side. Suppose we know that our urticaria is happening in the entire body, right? It's sometimes difficult to find out whether the problem the right side or the left side. So what we can do, ear apex, we can bleed both ear. There is no problem. Bilateral ear apex can be bleed bilateral, both ear. Remember two concepts: needling in the opposite side, bleeding on the same side. This is the concept. But right now, same side for the urticaria. What is the same side? Person is getting itching here, itching here, itching here, itching here. What is same side? No same side. Both, it's everywhere. Then bleed ear apex, both the side. As soon as you bleed the ear apex, immediately you will see the result because it's a wonderful treatment. Then other point, you can see, oh, the symptom more in the right side. Then you can put in the left side, right? Like if you talk about the hand point. But even sometimes it's difficult to find out, oh, symptom equally in both sides, then choose any hand. Then coming in the leg, I will tell you, leg rapid horses, you can even put bilateral. Most of the thigh point we can put bilateral because thigh point working in the very deeper level, all the thigh points. So thigh point, whether the line in the central line or the inner part of the thigh, medial part of the thigh, or the lateral part of the thigh, most of the point we can put bilateral, right? So gallbladder 31 also we can put bilateral, gallbladder 31. Because we are treating urticaria. Suppose we are treating the pain, migraine headache, we want to put gallbladder 31, then put opposite side. Headache this side, then gallbladder 31 opposite side. Lower back pain, you want to put gallbladder 31 because I told you the gallbladder 31 is the point who is working for any pain. Left side pain, then put the gallbladder 31 on the right side. In that way, we can choose the side. Now, I would like to bring a focus on one thing: 88.17, 18, and 19. These 3 points. If you remember these 3 points found in the stomach meridian, the first point is 5 tune up, then 2 tune up, then again 2 tune up, 3 point unit. Again, I will tell you, we have to feel the one protruded part here. that is called ASIS. Then the lateral side of the knee, draw the line, put the 3 point. This is one of the great points for lung and skin. What is skin? Skin means psoriasis, eczema, any skin infection, urticaria, any growth, wart, thickness of the skin, even cataract. Cataract is a thickening of skin. Cataract is thickening of skin. Thickening, some growth. Even any types of the skin problem. Even there is a pus formation somewhere. Pus is coming out from the skin. Even pus is coming out from the ear. There is a pus is coming, skin infection. So the 88.17 and 1819 are the wonderful point for entire skin problem. There is a skin problem inside, outside, inner, outer, anywhere. Nasal polyp, you can use 88.17, 1819 because the nasal polyp is connected to the skin. Also, the nose is the part of lungs. 88.17, 1819. All problem of the skin, whether the white spot, vitiligo, leukoderma, or the pigmented skin, you can use in both conditions. Because whether the white spot, white skin, that is also the skin problem, or the pigmented skin, that is also the skin problem. We have to bring the skin in the harmony by 88.17, 1819. Sometimes there is an infection in the ear because of pus formation, because of some thickening of the skin, and person is getting ringing sound from the ear. Even I will tell you, whatever the cause of tinnitus, whatever the cause of ringing sound of the ear, the 88.17, 1819 is one of the great point for tinnitus. Few of my colleagues has shared that they were trying this problem to tinnitus, a ringing sound of the ear, by many other points, but ultimately they got a very good results by 88.17, 1819 in the tinnitus or the ringing sound of the ear, which is a very challenging problem. Very challenging problem. So suppose if you want to get the ringing sound of the ear or the tinnitus of the ear, choose 88.17, 1819. But definitely we will choose A04 because A04 is very good for all the senses, even for the ear. So tinnitus is the problem of the ear. So we have taken, the person is having sign woo, 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 woo sound from the ear, that ringing sound. So, or we can tell there is a bend in the ear. So we can take gallbladder 31 or the 88.25, 88.17, 1819. And lingu is very good point. Lingu, we are taking this. Lingu is found at the junction of first and second metacarpal bone, and SI19 is the guiding point. SI19. There is a small intestine meridian, SI19, the center point here. We are massaging this point, then we are needling. There is a center part of the ear in front of the tragus. Very good point. SI19. Right? So SI meridian is very important meridian who is influencing the ear. Even the triple borough meridian is very important meridian who is triple borough meridian, starting from the ring finger also surrounding the ear. So definitely we are already using Sancha sun. Sancha sun is means over the triple borough meridian, then with the other point. So we have taken A04 or Sancha sun. Lingo. Lingo is very good point for any problem happening on the face. SI19 is the guiding point, then leg rapid horses for all ear infections, and gallbladder 31 because we want to expel the wind, right? So in this way, there are smaller points together working very nicely. Otherwise, sometimes tinnitus is very challenging. Generally, what I do, if the patient is suffering with tinnitus, I also advise apply the paste of nutmeg. Paste of nutmeg. Nutmeg, you know. So take the nutmeg, make the rub on the stone with the water and making the paste. So you might be knowing this, the nutmeg. I will show you in the image. Maybe few person, if you're not aware. This is nutmeg or jaifal. You are knowing that, jaifal. Actually, nutmeg is doing sedation. It's a calming down. It's reducing the wind. You can make the nutmeg paste while rubbing nutmeg on the water on the stone. Apply anywhere if you want to reduce the wind. Suppose headache, apply here. Apply on the root of the ear all around. It will calm down the triple bottom meridian and it will calm down the ringing sound of the ear. So this is also calming agent, nutmeg. Okay. Then other than that, you can apply these points. Even we can do Karna Purana. In the Ayurveda, it's written Karna Purana, putting the oil in the ear. There are lots of the oil we can put like Bilvadi oil, Bilvadi we know. Bilvadi, written in the chat box, Bilvadi oil. So putting the Bilvadi oil in the ear, around applying the nutmeg paste, and then doing the massage here like SI19, and even we can massage multiple point around the ear, spending at least 3 to 5 minutes in the massage. Then put the Sancha Sun, Lingu, right? In the leg, 88.31 in the leg, right? Then 3 point in the stomach meridian. It will work very nicely for the any ear problem. Sometimes in the middle ear, there are 3 bones. Doctor are telling, oh, bone chipak gayi hai. Doctor will tell you, bone chipak gayi, bone got stuck. Bone got stuck together. Bone is hugging together with each other. They shouldn't hug. They should be little, should keep the gap. Okay. So there is a disturbance in the hearing. We can treat with this product. This is one of the great products. So A04 or Sancha Sun, we are treating the tinnitus. It's working for ear. Lingu, then massaging SI19 or putting the needle, leg rapid horses and gallbladder 30. Excellent combination for any ear problem, any. So now I would like to bring a focus on very one common problem that is called tachycardia. What is tachycardia? Look at here. Normally, normal heartbeat 72 per minute or maybe 60 to 100 beat per minute, right? 60 to 100 beat per minute. That is a normal heart. But when the heartbeat is going beyond the 100, like 110, 120, this condition is called tachycardia. tachycardia. Okay. So heart is beating very, very fast. Beating very fast. So how can we treat this tachycardia condition? Definitely the first point will be Sancha, because I already told you Sancha is one of the great points for heart. Sancha, it's very near to, it's overlapping with the triple wormhole meridian. Now we'll be treating the 88.0123. These are the point of heart. Now we'll be coming in the central part of the thigh. The central part of the thigh. So this is the knee. From the knee, we are going in the central line. 5 tune up, 2 tune up, then 2 tune up. These are the 3 point called 88.010203. The very good point for heart. They can treat any problem which is having connection with the heart, whatever the problem. Whether the tachycardia or the bradycardia, whether the excessive heartbeat or the poor heartbeat, these points will treat any condition of the heart. Now we'll be coming to the central line. So central line is this, you know that. Central line of the thigh is this. So this is a thigh. Just exactly from the central, we are going 5 tune. So we are drawing the 3 point, 1 point, with the 5 tune here in the center. Then 2 tune up, 3 point unit in the central line. Again, I will tell you, we can, in place of 5 tune, if I'm putting the needle in the 6 tune, there is no problem at all. But please be in the central line. Central line means that is very good for heart. So question comes, why the central line working for the heart? There are multiple explanations given by the master room. The explanation number 1, this is the chest cavity, navel, abdominal cavity, and the genitals. So this is the chest cavity. So when we are putting the needle here, it's working on the heart, it's working on the lungs. The concept number 2, on the one side, we are having stomach meridian. On the other side, we are having spleen meridian. On the lateral corner, if we see there is a stomach meridian. On the medial corner, if we see there is a spleen meridian. This point is just in between. So when you are putting this point, it's treating the stomach meridian as well as the spleen meridian. Or this point, this line is having energy of the stomach meridian as well as the spleen meridian. Then stomach meridian is going from here and passing the chest. So stomach meridian is having connection with the heart, and spleen meridian is also having connection with the heart. In the organ clock cycle, we know spleen and heart are never padosi. We know in the organ clock cycle, 9 to 11, 11 to 1. So whether you treat the spleen, it is working on the heart, or you treat the stomach, it is working on the heart. We are treating the central line, which is having wonderful energy of the heart. So we are putting the 3 point here, 88.010203, and Sancha. Oh, high heartbeat. Sancha opposite side and 88.0123 opposite side. Immediately you can see the result. The faster result to the ear apex bleeding from both the ear, because ear apex is the wonderful place who can reduce unwanted energies from any part of the body. Ear apex bleeding. So what we have done? We have done Sancha. Sancha is very good for heart. 88.0123, very good for heart. Ear apex bleeding, very good for heart. Now, coming to the heart 7. Heart 7 is also called Shanman. The heart 7 is here, the sun point of the heart. It's the calming down point of the heart, very good for sleep, very good for insomnia. Heart 7. The other name of the heart 7 is gate of spirit. Gate of spirit, heart 7. So we are also putting the heart 7. Heart 7 will reduce the unwanted energies of the heart. Now we'll be putting the one more point that is called heart gate. We know this is a small intestine meridian. A small intestine meridian going like this, going from the border of the bone, and reaching till this pointed part. This is the small intestine meridian. In the small intestine meridian, we are having three gate: heart gate, liver gate, intestine gate. We will discuss when we are discussing 33.0. So heart gate in the upper part, liver gate in the middle part, intestine gate in the lower part. Right now, I'm going to tell you the heart gate here. From this pointed part, if I go 1.5 tune, this is the location of the heart gate. Is one of the great point for the heart. So look at here. So from this pointed part, I will go 1.5 tune. I will see the border of bone and I will put the needle here. See, my needle is pointing upward. Excellent point for the heart. I will put one extra needle. So from this pointed part, one first needle will be 2 finger up. I can put one extra needle here. I will tell you, I have put this point to too many patients. If anyone is telling, oh, I'm having some heart pain, put this needle on the opposite side. If the heart pain is the left side, put this needle on the right side. Immediately pain will go. This is called heart gate. How to find out the point? I will repeat again. How to find out the point? From this pointed part, you have to go 2 finger up or 1.5 tune up. Maybe my needle a little more up, right? From this pointed part, I have to go only 2 finger up. Then I have to search the bone. On the border of bone, I have to put the needle directing upward. I can put one extra needle here. Then I will tell the patient, okay, keep the hand like this. Don't do hand like this. Because if the person is doing hand like this, then because the needle is just next to the bone, so person might feel little discomfort. This is the heart gate. And as per the master room, any point working for the heart, also working for the knee. So if you are putting in the right elbow, knee pain will go away from the left side immediately. Because we can't put the downward. Downward is the bone. There is no place. That's why because we are getting more muscle area, right? So in this way, in the master tongue, there is no direction. Just we are putting the needle as per the vein where we are getting more flash. Because heart is made by too much muscle and muscle. Heart is muscle. So this 33.12 or the heart gate point, we are putting in the way so that we can penetrate more and more muscle. So the last point I would like to show you 11.19. 11.19 point found in the palmar side of the middle finger. So this is the middle finger. In the palmar side of the middle finger, we can see 2 point on the border of bone or on the D line. 11.19. These points are called, the name of these points, heart normal point. They're very good for heart palpitation, heart disease, tachycardia, bradycardia, any types of the heart problem, rheumatic heart disease. Nowadays, there are too many patients having heart problem. So please remember this protocol because this is one of the great protocol for all heart conditions. Number 1, Sancha sun. Number 2, 3 point in the heart line. Then ear apex bleeding, you can do once a week. Heart 7. Heart 7 can be put bilateral also. Heart 7 you can put bilateral also. Then 33.12 and 11.19, 1, 2, 3, 4, 5, 5, 6, there are 5 to 8 point. I will tell you that too many patients nowadays suffering with a heart attack. There are too many patients are very sensitive for the heart problem, and too many patients taking regular medication for the high blood pressure. In the family history also, there are many persons having a heart condition. So please remember this protocol. This is a very good protocol. Even patient is coming to you for the knee pain, you check the BP, you check the heartbeat, and if the patient is having heart condition, treat this. Even knee pain will go away, back pain will go away, leg pain will go away, cramps will go away, headache will go away, multiple problem will go away just by balancing the heart, because heart is connected with the spine, heart is having connection with the knee and all that. 11.19 is the point in the D line. Look at my finger. This is the middle finger. D line, line A, B, C will be the central line. Then D will be the other side. In the D line, I have to put two needle here in the D line. A, B, C, D. Two point in the middle finger D line. They're one of the great points for heart. So look at the two needle on the D line, on the middle finger. I have inserted little, but for the patient, I will insert little more. Okay. Got it? Middle finger. So we have to treat, suppose we are treating the patient. If the patient is suffering with some problem, and we know heart is in the left side, so definitely we are putting the right side. But when patient is relaxed, one day we can put in the right side, one day we can put in the left side, one day right side. Why? Otherwise, what is the use of left side point? We just keep on putting the right. Then what is the use of left side point? Heart can be divided in two parts. Then we can consider, if heart divided in two parts, right heart and the left heart, right? So in that way, one day we can put in the right side, one day we can put in the left side. So we can treat entire heart. So look at this protocol once again, the very good protocol for the tachycardia and any problem which is having connection with the heart. So you can treat the patient. If the patient is having high blood pressure, high heart rate, high heartbeat, you always can add these all the points. And if person is suffering with the insomnia, you will get the result. Back pain, you will get the result. Knee pain, you will get the result. Multiple pain, you will get the result with the same protocol, right? 11.19 is here. In the middle finger, there are 2 points, there are 11.19. I already discussed 11.19 earlier during the discussion of 11 point unit, right? Okay, fine. So now see you tomorrow. Let's close the session and we'll continue the discussion tomorrow. Fine. Okay. If you have any question, we'll discuss tomorrow. I have another meeting at 6 o'clock. So I have to close the session. So you write down your questions. We'll have time tomorrow and we'll discuss question tomorrow. Thank you so much. Or you can put in the group. So if it's small, then we can reply.